to all doctors who are watching right now. Thank you very much for tuning in to another episode of Docus by My Finance MD. I made this Docus program for all the doctors out there to be able to help them in all aspects of their life. Doctors, medical doctors especially, have been serving our country very wholeheartedly and tirelessly, but nobody serves them. So this program aims to serve our doctors to help them, make them equipped on how they will face life as it is. I hope you will have fun with my interview. Our very special guest right now is a lifestyle medicine physician. Let us all welcome Dr. Johann Kim Mañez. Hi, Dr. Johann. Tama ba, Doc?
Hi.
Ano pong nyo? Nickname?
Johann.
Johann pa. Okay.
Johann lang. Okay, Johann.
Yes. Let's start na the question kasi ang daming nagtatanong sa akin. Nag-post kasi ako ng questions to my page and what they want to ask you. So first and foremost, Doc, I just want to ask, since lifestyle medicine is a new specialty right now in the Philippines, tama ba ako?
Yes, it is.
Can you tell us something about it, Doc, and when it began, and how did you become a lifestyle medicine physician?
Okay. Can you hear me clearly?
Ay, yes po. Although hindi kayo nagalaw sa video. Sige lang po, go.
Minsan puputol-putol pati ikaw, napuputol ka sa akin dito.
Alright.
Okay. So should I just continue?
Yes.
Hello?
Ay, hello, Doc. Okay, I'll ask the question again. Since Doc, the lifestyle medicine physician as a specialty is relatively new in the Philippines, can you tell us something about it and how did you become a lifestyle medicine physician?
Okay, so it's much clearer now. A while ago I couldn't hear the question. Lifestyle medicine initially was from the United States and Australia. It started in 2004. When I learned about lifestyle medicine, it was in 2010. So during that time, I thought there would be lifestyle medicine in the Philippines by then. So I went from hospital to hospital asking about lifestyle medicine because I wanted to train and become a lifestyle medicine practitioner. Unfortunately, there was no lifestyle medicine in the Philippines at that time. So I decided I had to train and go to the United States and train in lifestyle medicine. So every year I would travel to the United States, undergo courses in the United States, attend conferences, and I even had to do courses online just to train myself to become a physician. So since 2010, whatever I learned, I was actually applying immediately in my practice. So late 2010, 2011, I started practicing formally lifestyle medicine. Since there was no residency training, because lifestyle medicine is very new, so I had to do a lot of work training myself as well as getting trained by others who were ahead of me. And through immersion in lifestyle medicine, through study, and of course, reviewing and studying the latest in terms of evidence, I learned lifestyle medicine pretty much the hard way because there was no one directly teaching me. I was always searching for people who knew about lifestyle medicine until, of course, I was eventually, as part of the American College of Lifestyle Medicine, that was the only organization with lifestyle medicine at that time. So I joined the American College of Lifestyle Medicine. They had different CME trainings online. So I immersed myself completely in lifestyle medicine practice, training and practice. And eventually I was given awarded the fellowship of the American American College of Lifestyle Medicine. So I became the first international fellow of the American College of Lifestyle Medicine at that time. So in 2015, between 2010 and 2015, I was hired by a local hospital to run programs for their health and wellness department in Manila. So I did that, and what I did was apply all the things I learned from lifestyle medicine and created these programs. There was actually one program that was already proven to be very effective at reversing heart disease, reversing chronic type diseases. So the hospital adapted that program, and we ran it. It's called the Complete Health Improvement Program, or CHIP for short. And we were able to graduate more than 700, 800 people from that program who were able to change their lifestyles. They were able to reverse their diabetes, their hypertension, even their heart disease. There were several who also reversed cancer, so that was really exciting for me. To be able to reverse cancer is very seldom seen in clinical practice, and yet through lifestyle management, many of my patients were able to reverse even their cancer. So that was, for me, that was almost miraculous, because you don't really see a lot of reversal of cancer. I mean, you see one or two people with spontaneous remission, but other than that, it's usually chemotherapy, and then eventually the patient dies, right?
Yeah.
Surgery, chemotherapy, and then radiation, the patient dies. But now there is hope. I mean, people now see that, okay, lifestyle is very powerful. Diet, the food you eat, is very powerful in reversing disease. And so in 2015, after about 4 or 5 years of conducting this program, we even had participants that were medical doctors. So medical doctors who have who the medical system has given up on because they themselves had chronic diseases. When they joined, they realized that, okay, this is not only new, but it's actually eye-opening, that a simple thing such as a change in diet could actually heal a person. And because they experienced the healing for themselves, these doctors were convinced that lifestyle medicine was the way to go in terms of treating the major burden of disease in the Philippines, which are chronic diseases. And so with a group of some of these physicians and their colleagues who were also interested, we established the Philippine College of Lifestyle Medicine. So that was founded in 2015. Actually, 2014 we got together, but it was only in 2015 that we were able to start processing the SEC registration, business permits, everything. And so since 2015, we've already conducted 4 annual conferences. We have also conducted a mid-year conference last year. Early this year, before all the COVID craziness came about. And that was in Cebu. No, wait. That was in Davao. So we had our mid-year conference in Davao. And then we recently concluded our annual conference, online annual conference. So we've had 4 annual conferences all in all. And we've also conducted the International Board of Lifestyle Medicine exam 4 times in this country as well.
Wow.
So we are one of the leading countries in terms of lifestyle medicine in Asia, if not the only country, because the other countries, they don't even have a formal organization yet. So we used to always be the tail. Well, the Philippines is now the head with lifestyle medicine, so I'm really happy about that. And that's basically how lifestyle medicine began and is continuing in the Philippines. Now we are recognized. We are unofficially yet, but we are already recognized by the Philippine Medical Association, the PMA, under family medicine. So under the family medicine specialization. Okay, so we're being placed under them for now, because
Oh,
according to the constitution of the PMA, there only has to be eight. There are eight major societies for medicine, and family medicine kind of fits or overlaps with lifestyle medicine. So that's where we were placed under for
okay.
now.
Okay, for now. Some maybe in the future we'll have our own category.
Yeah, yeah. We're hoping that the constitution of the PMA will be changed. I mean, these are the plans of our president of the Philippine Medical Association. So when that happens, then we can apply as a separate society under the Philippine Medical Association.
Hey, Doc, from the time it started, how many are already specialized as graduated as a lifestyle medicine physician in the
Yeah.
Philippines?
So in the Philippines, we now have 50 diplomats, 50, around
Wow,
50 plus
50.
diplomats of lifestyle medicine. But in terms of membership, our organization, the Philippine College of Lifestyle Medicine, has more than 200 members at the moment. So
Mm.
we're expanding.
Okay, Doc. Ang dami kasing nagtatanong sa akin when I posted the question that I'll be interviewing you. They asked how to become one, how to become daw you, what institution are offering this program, and of course, what are the training requirements. Yun. Basically, the question is how to become one.
Okay, so of course you have to be a medical doctor before you become a lifestyle medicine specialist.
Yeah.
So you take your medical board exams. After you take your medical board exams, then you can start training. First, you become a member of the Philippine College of Lifestyle Medicine. And then right now, all our training is online, especially with this
Wow.
pandemic. There's really no one-on-one or face-to-face training that we can do. So right now we're having online courses that you can take, and once you accomplish these courses, and you have to actually practice lifestyle medicine in your own practice. Once you are able to do that, then you submit the requirements. One of the requirements is a case study where you've actually had a patient with some type of chronic disease, and using lifestyle medicine, you were able to reverse some of the risk factors and even the disease itself through your management using lifestyle medicine. So once you've accomplished all the requirements, then you take the board exam. Right now, what we have is an international board exam, which is really good. If you take the exam here in the Philippines, what happens is you're recognized as a lifestyle medicine doctor throughout the world.
Wow.
So it's the first board exam in the history of medicine where once you are able to pass it, you will be recognized in the other parts of the world as a lifestyle medicine specialist or as a lifestyle medicine physician.
Wow, that's great, Doc. That's great news kasi a lot of them are asking eh. And do you have to take another specialty, or after graduation, after boards, you can go straight into this?
Yeah, straight into lifestyle medicine if you want. It's a specialization of medicine. Yeah, I mean, the thing is, there's two levels of lifestyle medicine. The first level is the general level, which is basically like any other specialization. I mean, we all know how to do a little bit of OBGYN. We all know how to do a little bit of surgery.
Yeah.
We know how to do pediatrics, internal medicine, etc. We know a little bit about everything as a generalist.
Yeah.
Okay, so in essence, that's the first level of lifestyle medicine. You also need to know the basics of lifestyle medicine as a physician. And that is why today we have one or two colleges. One college is definitely College of Medicine I'm talking about, has in their curriculum, they've incorporated lifestyle medicine. So I was able to help them incorporate lifestyle medicine into their curriculum. I used to actually teach in that college. After 7 years, however, of teaching, my workload and my responsibilities have grown sky high. So I had to discontinue that. and I'm now focusing on really getting the practice of lifestyle medicine on the road, so to speak, and helping the general public get their health back, take control of their own health, and
Yeah.
become healthier individuals. So
Yeah.
that's what I'm doing right now.
It's really a great advocacy because prevention is really better than cure always, right, Doc? So, Doc, how ano,
Absolutely.
how
Prevention
long? How
and
long will
yeah,
sorry. Yes. How long is the
you're
training
saying?
going how long is the training is going to be for a physician who wants to take the specialization of lifestyle?
Yeah. Uh, for now, the training can be as much as short as 6 months.
Yeah.
Okay, but for the practice, you have to still practice lifestyle medicine. Some conditions take a little bit longer to be able to reverse.
Okay.
So the goal really is to have your own experience with some of your patients with chronic disease. So as short as 6 months to a year probably of training initially, because again everything is online right now.
Yeah.
But we are looking in the next 1 to 2 years to develop a residency training program,
Oh.
and the residency training will most probably be 2 to 3 years of training. Nothing's
Oh.
final yet, but that's the amount of time I think a person will need, a doctor will need to be able to master all the different principles and competencies of in the practice of lifestyle medicine.
Wow, that's great, Doc. So if ever they want to apply, where will they go? Is there a website or a page?
You can just go to the yeah. You can just go to the you can just go to the lifestyle medicine website of the Philippines. It's called lifestylemedicinephilippines.org.
Yeah.
So just type that on your browser, and then it'll redirect you to our official page, our official webpage. And then go to click the tab on training or education, I think it is. Then it'll explain to you the different requirements for the courses that are available.
Yes, that's great, Doc. That's great news to everyone who's asking, and it's a very good time this time of pandemic to do something like that. Lalo na if they are planning to
Yeah,
do
absolutely.
residency. Yeah. So, Doc, iba naman question ko. Ang question nila is, what are the
Okay.
challenges what are the challenges of taking or in facing this kind of specialty in your practice?
The challenge is studying, I guess,
Yeah,
because
always
uh,
starting.
when you apply, I mean, once you've learned all your skills, right? Once you've learned how to, for example, cook food a certain way, if if you know how to do counseling, lifestyle medicine consultation involves a lot of health coaching. So these are aspects of your practice that you have to develop, and usually it's more of people skills that you have to develop, because you're going to be learning how to adjust to the hardships of people changing their lifestyles. So
Yes,
you have to
yes,
understand them and be at that level, because it's so easy to say, oh, you have to do this, do that, do this, do that, right? But uh, practical application of the things you're telling them, the person has no idea what you're saying. So you really have to go down to the level of the patient and see where they are at in terms of their situation in life.
yes,
So once you understand where they're at, then you can teach them, okay, so this is how you start to change your diet, for example. These are the sources of food in your community, so that's where you recommend them to do their groceries, for example.
yeah.
In terms of exercise, you have to know all the limitations of the patients, and then be able to apply what you've learned in lifestyle medicine to their situation. So I think those are the main factors, main hurdles, I would say. Once you've really mastered your people skills, and you've mastered really empathizing with the patient, understanding their needs, and then redirecting them to solutions, then we're talking that
Yes,
we're
yes.
on the road to actually getting that patient better.
Actually,
And so that's what I really think we should accomplish. Yeah.
yeah, I think that's the very challenge of changing the lifestyle, because that's really one of the things that's hardest to change, the habits of people who
Yep.
already used to that kind of lifestyle, di ba, Doc? So, ang question ko lang
Yes.
is, another question is, how do you get patients? Because in a normal setup in a hospital, usually you don't look for, do you have a lifestyle medicine? Di ba? People are used to looking for pediatrician, internist, surgeons, but do they look for a lifestyle medicine physician, or how do you get patients? How do you get yourself known there?
I mean, lifestyle medicine has been around the Philippines now for about 10 years. So a lot of people are, or if they don't know it yet, they are beginning to learn about this specialization in medicine. So, I mean, hospitals like the Medical City, for example, they now have a health and wellness department that have lifestyle medicine physicians practicing there. These are big hospitals. I'm not sure if St. Luke's, but other hospitals, if you're familiar with a very old hospital, um, Manila Sanitarium and Hospital
Yeah.
in Pasay. So
Mm-mm.
that was the hospital that I initially was holding these lifestyle medicine programs in. But then there was just so much demand outside that I had to leave the hospital and continue my practice, my private practice, because there was so much demand for my time.
Oh,
So
too
uh,
much demand,
people will be looking for you. I mean, my inbox for my email, my Facebook messages, there's it's just full of inquiries of
right?
patients asking for services, and sometimes it's overwhelming as
Oh,
a physician. And that's why I'm encouraging other physicians to go
yes,
into lifestyle medicine, because by doing that, then we are able to kind of thin out the number of patients.
yes,
There's a
yes,
lot of
yes.
patients out there looking for solutions, looking for some way to heal their disease,
Yeah,
and I think lifestyle medicine is the answer. That's why I always tell my colleagues who are hesitant, into going into lifestyle medicine practice or lifestyle medicine training. I show them the data, and I'm showing them, look, lifestyle medicine is completely sustainable. People look for us today. And that
yes.
is why I think the future of healthcare is lifestyle medicine.
Wow. So, very good news, Doc, kasi a lot of people or our doctors are really asking what's lifestyle medicine, diba? So, yeah, you're here right
Yep.
now, and we are a blessing to everyone who's watching, especially the doctors who's contemplating on what specialty they would love. So, 50 pa lang yung specialty. So, maybe you can try lifestyle medicine, especially now in COVID time that you don't have any way on to train outside, diba? Right, Doc? And also, um, okay, so may mga questions tayo, Doc. Few lang for ano naman, application. As a lifestyle medicine physician, Doc, what are your views daw on the different diet like keto, vegan, intermittent fasting? Yan, mga hot questions for you.
Okay. So there are three diets you mentioned:
Keto,
keto diet. What was the other
vegan,
one?
yeah, vegan and intermittent fasting.
Okay, let's start with the ketogenic diet. Okay.
Okay.
This has been, yeah, for some weird reason, it became a trend. Everybody wanted to be on a ketogenic diet. In medical practice, I'm talking about regular medical practice. I'm not even talking about lifestyle medicine yet. Okay.
Yeah.
Regular medical practice, there are only two conditions that indicate a ketogenic diet. The first condition is if you are extremely morbidly obese. That is one indication. And the second indication is if you have refractory epilepsy.
Yeah.
Okay, just those two conditions. Refractory epilepsy means you have so many seizures, your
Yeah.
seizures are so bad that even medications do not work anymore. And so a ketogenic diet, which is very high in fat and also animal protein or protein, that's when they apply a ketogenic diet. And that's just for those two conditions.
Yeah.
Now, yes, if you do apply a ketogenic diet, in probably 3 to 6 months, you will lose a lot of weight, but then you increase your risk for dying of heart disease and a stroke. Okay? So this is what the evidence shows us. So I keep telling my patients, look, okay, you want to go on a ketogenic diet, you become thin, and then you die of a heart attack. So what is the sense in that, right? They look at your body in the casket and you're nice and sexy, but you're dead. So I mean, that I don't think that is a good way to approach losing weight. A ketogenic diet, it's a very dangerous way of losing weight. And yes, there are many people who are advocates of a ketogenic diet. If you really want to do a ketogenic diet, that is the risk you're going to take. For some people, what they do, and I don't advise this at all, they go on a ketogenic diet, and once they're thin, they start weaning off from the ketogenic diet, and they start eating a more healthier diet. That's what other people do. So they're kind of like cheating the sudden weight loss. But again, I wouldn't risk it, because you might not reach that point where you get the chance to actually slowly go back to a healthier diet and become healthy, right? You don't want a stroke. You don't want a heart attack. And a ketogenic diet increases your risk for developing both of those. Okay, so let's go to the what's the other two diets? The intermittent fasting.
Yes, intermittent.
Let's go to the intermittent fasting first before I speak about the vegan diet.
Okay.
So intermittent fasting is fine. Intermittent fasting is good for weight loss. It's also good for improving your immune response or your immune system. Okay, but it also depends on what food you are eating, because intermittent fasting is simply a pattern. Okay, a pattern of when you eat and when you fast. That's what intermittent fasting is. But the diet, when you do intermittent fasting, is very important. What do you eat during your intermittent fasting protocol or program, right? So for me, intermittent fasting is fine, and most of intermittent fasts are 8 hours of food intake and then 16 hours of fasting, right?
Yes.
Essentially in a day, and you're eating just 2 times a day, right?
Yeah.
So essentially in a day, if you are a person who will sit 8 hours in front of the computer because you have a desk job, instead of a more field work kind of job where you're walking, where you're physically active, then intermittent fasting is fine. Okay, you're not really needing all that extra energy from the food, so go ahead, do the intermittent fasting. But let's say your type of job is, let's say you're a construction worker and you're very physically active. You're lifting blocks of cement. You're lifting, you're lifting all these building material, and you're constantly on the move. You may find that 2 meals a day is not enough to supply you with the energy you need. So that is why intermittent fasting may not be for everyone. Okay, so this is why we really have to. I would advise you, before you do any type of dietary protocol or even this intermittent fasting, I advise that you go to a lifestyle medicine physician or a nutritionist, at least a nutritionist who understands lifestyle medicine. Okay, and we do have nutritionists who actually take the exam and become lifestyle medicine professionals instead of just lifestyle medicine doctors. We have lifestyle medicine professionals. So you can be a nurse and be a lifestyle medicine professional. You can be a nutritionist. You can be any allied medical health professional, and then take lifestyle medicine and take the board exam. Usually the board exam for the lifestyle medicine professional is, of course, a lot easier than the board exam for the physicians, obviously. But yeah, you can help with lifestyle medicine, and you can help with the advocacy of lifestyle medicine by doing that. So yeah, go to a lifestyle medicine physician, go to a lifestyle medicine professional, maybe a nutritionist or a nurse who understands lifestyle medicine, and ask about whether intermittent fasting is good for you,
Okay.
and your lifestyle. Okay.
Okay.
This is a very long answer to your question. Is that all right?
Okay, Doc.
One more diet, right?
Yes, the vegan.
Okay. So the vegan diet, you see, you can be a vegan and be very, very unhealthy.
Okay.
Okay. Let me say this. Some vegans are what I would call junk food vegans. Okay. They will eat vegan junk food. And the reason they're vegan is not necessarily for their health. They're vegan just because they love animals. And the reason why they're vegan is they don't want to eat animals.
Okay.
And that's a very noble approach and a very noble advocacy. But I'm a physician, so I really care about human health.
Yeah.
All right. So I would level up the vegan approach and say what people really should be doing is eating a plant-based whole food diet.
Okay.
Now, let me just mention something here. And for some people it may be controversial, but for me, I stand by this principle that let all diets die.
What's that, Doc?
Right? Because there's only one diet you should be eating, and the diet that I recommend is a plant-based whole food diet, because that is what our system, that is how our bodies were designed to eat. We were supposed to eat plant-based whole foods from the very beginning. Our anatomy, our physiology, our mouth, our intestinal tract, all designed to eat plant-based whole foods. And when we deviate from that type of eating, that way of eating, that's when we develop diseases. That's when we develop heart disease, all these chronic diseases that we have today.
So, Doc, what do you mean by plant-based whole food? Is it vegan, a type of vegan, or is it, can you still eat animal products?
Yeah, we're talking about the optimal diet, the optimal lifestyle.
Yeah.
And when I say that, I mean this lifestyle will help you achieve optimal health. Okay, so if it's optimal health that you are aiming for, I absolutely recommend a plant-based whole food diet, which means there are no animal products. All right, it's all whole foods, and when it's whole foods, it's foods as grown. So instead of eating, for example, olive oil, I recommend eating the olive.
Oh.
Instead of recommending corn oil,
Okay.
I recommend eating the corn.
Okay.
With the oil is natural in the corn. I want you to eat it in its natural form, not in a processed form.
Okay.
So most processed foods, they're not really very healthy, and they don't really do a lot of good for us. So plant-based whole foods is really the way to go if you want to optimize your health and achieve optimal health in general.
Wow. So we're learning a lot from Dr. Mañez. Okay, Doc, malapit na tayo. Kasi another doctor asked for this. Ang question na is, plant-based diet okay with doctors who are doing long procedures in ORs?
Oh, really? Absolutely. Yes.
Yeah.
Let me tell you about a cardiothoracic surgeon I know. He retired at the age of 95.
Wow, 95.
And the reason why he was able to keep going with his medical practice of being a thoracic surgeon, a cardiothoracic surgeon, is because he was on a plant-based whole food diet.
All right.
Okay, the last time he was interviewed, and I was there during that interview, was in 2000. I think it was 2015. I'm not very sure anymore. And during his interview, he was 101 years old.
Oh, grabe. And he's been
He was our
practicing
special guest in the American College. Yes. He was our special guest during the conference of the American College of Lifestyle Medicine. And I think this was in one of the Renaissance hotels in, I can't even remember where it was anymore, but it was in one of the hotels, one of the Renaissance hotels in a state in the United States, and he was interviewed by the founder of the Complete Health Improvement Program, Dr. Hans Deal.
Wow.
He was 101 years old.
So it's
and
very...
he didn't even have a hearing aid. He could hear perfectly well.
Because of the plant-based whole food, right? No? That's his diet. Okay.
Sorry, you're cutting. You're
Because
cutting
of
off.
the plant-based diet that he has, right?
Yes.
Yeah. Okay. Last two questions. So, Doc, I know that hydration is very important, but how important is it? How can hydration of the body be very good in your overall health? And what's your recommendation in hydration?
Okay. Yeah, our bodies are basically water. You know, we're 75 to 85% water. Some organs in our bodies, like our brain, is like 90% water. So basically, because we have a lot of water, and water is a basic medium for metabolic processes in our bodies, then obviously we need a lot of water. So that's why we have to drink a lot of water. And the minimum amount of water for a person to drink, if you're a female, then since you sweat less than males, your minimum intake of water should be 2.7 liters a day. And for males, it should be 3.7 liters of water. That's right. That's why you always have to have a water bottle with you.
Yeah.
And when you exercise, so when you do physical activity like a really strenuous or vigorous exercise, or even moderate exercise, you tend to sweat more, right? So as you sweat more, that means your body will need more water. And so you can drink to as much as 4 to 5 liters when you're training really hard, when you're doing a lot of physical activity. So 2.7 for females and 3.7 is kind of the minimum. That's the minimum amount that you should drink in a day.
Okay. That's really very important. That's why I always have my bottle with me, drinking it. So last question for because
Same with me, I always have a water bottle.
Okay, good job, Doc. So the last question that I have for you, Doc, is what is your ultimate advice right now for people to boost their immunity and health against this pandemic or this virus that we have?
Okay, that's a good question. So the correct term is optimizing your immunity.
Yeah.
Okay, because when you boost, okay, the term boost can indicate a hyperactive immune system. So we don't really want a hyperactive immune system. What we want is an optimal immune system. And the best way, again, is to number one, eat the right type of food, because the nutrients from a plant-based whole food diet will equip your body with the nutrients it needs to fight off an infection. It doesn't even have to be COVID. It could be any infection, for that matter. Okay. Number two, always as part of your diet, you should also take a vitamin B supplement, and that is B12.
B12.
Okay. You don't need the other B supplements. You don't need the other B vitamins if you are on a plant-based whole food diet, and if you're eating the 4 food groups of the plant-based diet, which is fruits, whole grains, beans, and vegetables. So these are the 4 food groups. If you eat these foods every day, they have to be on your plate every single meal, every single day, then you're getting all the nutrients you need. All you need now is a B12 vitamin. Okay. Once you have a B12 vitamin, then you basically have complete nutrition.
Okay.
So the next thing you want to do is be able to exercise on a regular basis. It doesn't even have to be too strenuous. So moderate intensity physical activity, and it doesn't have to be a formal exercise routine. It could be something like gardening, for example, or some type of moderate activity work every day. I suggest you do it outdoors so that you have the benefit of sunlight. Sunlight on your skin for about 30 minutes every day will give you all the vitamin D you need. So you don't even need supplements for vitamin D if you expose yourself to sunlight.
Oh.
And you have fresher air. Okay, so do that, plus sleep 8 hours every night. Okay, hydrate, stress less. Okay, so allow yourself to relax every so often. Breathe a little, enjoy the flowers, so to speak, right? Smell the roses, so to speak.
Yeah.
So do all that. And I think a very important thing that as Filipinos, and this is really great that Filipinos have, we have faith, right? We have our faith, we trust in God. And this is something that we've found to be very scientifically proven, that when you have faith and you pray and you meditate, you actually improve your genes, and your genes will produce the epigenetics, okay, of our system will shut down the disease genes. So even if you have diabetes, your diabetes will be shut down by your genes when you have faith, when you have a sense of a bigger person in charge, of your life. And this is really, for us Filipinos, this is just.
Oh, nawala si Doc. Hello? Ayan, you're back, Doc.
Yeah, and somebody called, and then so my phone got
Okay,
the connection cut.
You were caught when about faith.
Yeah, so as Filipinos, we have faith, and that is something that is really great. We've suffered much oppression in our history. We're now free, and so that we maximize our freedom and we maximize our health, one good thing is that we can trust in God, that He will really help us with getting us better.
Yes.
So just follow all those things that I mentioned, and you will do well.
Yes, and that. Just don't forget, if you go outside, you still wear your mask. Right, Doc?
Yeah, of course. The thing is, I think COVID, yes, it is deadly. It has killed people.
Yes.
But when you compare the number of people that it has killed to the number of people who die because of other causes, I think COVID has been over sensationalized. I don't think people should be afraid of COVID at all. What they should do is educate themselves to live a healthy lifestyle, so that even if COVID does get them, okay, even if they're infected with COVID, it's just like another flu virus. I mean, how many people die from flu, right? It's almost the case fatality rate is so low that people don't even bother to think about the flu virus, right? If you get it, then you get it, and then you recover, and then you're alive. And COVID is pretty much the same. The people who do die from COVID already have other diseases.
Yes.
So any type of viral infection that they do, they have lots of comorbids. So any other type of virus that they do get, they could actually die from because they're already immunocompromised.
Yeah.
But you'll notice that a lot of people have tested positive with COVID, and yet they have no symptoms. That's because their immune system is intact, and COVID is nothing to them.
Yeah.
So this is advice from a physician who has seen the effects of COVID, and I think it's not something we should be afraid of. We should just optimize our immune system and live a normal a life as possible. COVID should not be something to be feared.
You just need to eat the right food, exercise, boost your immune system, drink water. That's it, right, Doc?
Optimize your immune.
Yes,
Yes,
optimize
optimize your
immunity. Yes. So thank you very much, Doc. Sobrang thank you for giving us this time. I know that you're somewhere there. You're also in the car because of the poor signal, but you're here with us, and really thank you for giving us the time. And
No worries.
I hope that a lot of people will become lifestyle medicine physician. Actually, I'm even interested.
Yeah, yes.
I'm interested. Okay.
Absolutely.
Yeah. When we met,
So
20
you're a
years.
medical doctor as well?
Yes, yes, yes.
Great, great.
You remember we met in a talk in Laguna. I was talking and you were also the speaker. And yeah, we talk about it. That's why how I knew you before. So thank you very much for really giving us the time. Okay, so if ever, Doc,
Okay, you're welcome.
yes, they just go to the Lifestyle Medicine Philippines.org, right?
lifestylemedicinephilippines.org
Okay,
to learn more about lifestyle medicine
okay,
and how to become a lifestyle medicine
okay.
doctor.
Okay, you want to invite any of them or anything with your program? Nothing, na?
Yeah, sure. I'm affiliated with the Four Leaf Lifestyle Medicine Group, my lifestyle medical group in Manila. So if people need lifestyle medicine physicians, there are lifestyle medicine physicians in the Manila area. Just go to our website, also our Facebook page, Four Leaf Lifestyle Medical Group, and we have a group of physicians who are ready to help people.
Okay.
Also, look for me on Facebook. Just type my name, Johann Kim T.
Actually,
Mañez.
Doc, I follow
If you have any questions, just go ahead and message me.
Yeah.
I mean, there's like 100 messages I receive a day, but
Oh no.
I go through them as much as I can throughout the day. When I get home, that's usually the last thing I do. I go through my messages.
Yeah, that's why we are very, very fortunate that we have Dr. Mañez here with me for this another episode of DocQs. I hope you follow him on Facebook, and if you want to become a lifestyle medicine physician, you can just go to the website and apply and train. Diba, Doc? Okay, thank you very much, Doc,
Yeah.
again. I hope we will
You're
have
welcome.
you again in the next few episodes. Thank you so much. Okay, thank you.
All right. Stay healthy.
Yes, thank you. Stay healthy,
Bye-bye.
everyone. Bye-bye. There you go, everybody. Another episode of full-packed knowledge that you can use with your family, with your life, and with your real-life practice. So thank you very much to our very special guest. I hope you learn a lot, and until the next episode of DocQs by My Finance MD. Thank you. Bye.